The final part of the e-learning today is on mental health, crisis, self-harm and suicide. Please be aware before we start this module that we will be talking about sensitive issues around self-harm and suicide, so please do take good care of yourself and seek support if you need to following completion of the module. So what is a mental health or emotional crisis? While crisis is subjective, it's unique to every person in respect to what it looks like and what it feels like, what triggers it and what the contributing factors are, and how an individual copes and manages during crisis. In a nutshell, a mental health or emotional crisis means feeling overwhelmed by intolerable or distressing, intense and frequent thoughts and feelings. It can lead to a sense of struggling and feeling unable to cope and manage. As a result of feeling unable to cope and manage, people respond and behave in reactive, impulsive or risky ways. So crisis is different for everybody. It doesn't necessarily mean that somebody is or will engage in self-harm. It also doesn't necessarily mean that somebody is experiencing a mental health illness or condition. Crisis can occur in response to many life events, and situations can be discrete or single episode. For others, they may experience multiple episodes of crisis with similar or different triggers and presentations. So crisis, self-harm and experiencing thoughts of suicide are very distinct things. Not everybody who engages in self-harm will be in crisis, and not everybody who engages in self-harm will be experiencing suicidal thoughts or feelings. Not everybody who experiences suicidal thoughts and feelings will engage in self-harm, and they may not appear to be in crisis. So now I'm going to talk through some situations that may trigger or contribute towards experiencing a mental health or emotional crisis for children and young people. This list is not exhaustive. Relationship difficulties and arguments with friends, families or romantic partners. Bullying, teasing, harassment, which includes verbal, physical, emotional, financial, sexual, both direct and indirect. Abuse. Again, verbal, physical, emotional, financial, sexual, neglect, and again, either direct or indirect abuse. Being in or worrying about being in trouble. Having multiple demands placed on them, having too many things to do, too many things to process. Stressful or traumatic life events which can be sudden, unexpected, or even expected, such as accidents, injury, illness, bereavement, family breakdown, or a change in living circumstances. Physical illness or injury, or even pain. Change or transition, particularly between schools. Perceived or real failure or not meeting expectations or hopes. Build-up of difficulties. Extreme fatigue. Drug and alcohol misuse. So what might you see if a young person reports or experiences that they're in crisis? We've already covered many signs and symptoms, so there may be some similarities, but these are the key things to look out for that might indicate a young person's in crisis. Low mood or mood fluctuation, tearfulness, anxiety, agitation, irritability, emotional outbursts. Appearing confused or muddled in thought, difficulties with concentrating, which may lead to confused or incoherent communication. Verbal or physical hostility or aggressive behaviour towards themselves or other people. Antisocial or reckless behaviour that appears impulsive and reactive. Running away, hiding. Becoming withdrawn, isolating themselves or becoming uncommunicative. Or reassurance seeking and not wanting to be alone. Difficulties with school attendance and performance. Difficulties completing daily functioning tasks such as getting up and getting dressed. Poor personal hygiene. Feeling hopeless or despairing, not seeing the point in anything. Loss of interest in previously enjoyed activities. Feeling guilty, feeling overwhelmed or responsible for things that are not their sole responsibility. Rumination, so overthinking, experiencing intense or frequent distressing thoughts. Physiological symptoms, such as headaches, stomach pains, digestive upset, change of appetite, so either over or under eating. Changes to sleep patterns, oversleeping or being unable to sleep, fatigue and loss of energy, or becoming highly agitated, and engaging in self-harm or experiencing thoughts about ending their life. Now we're going to talk a little more about self-harm. So please be aware it can be upsetting and potentially triggering to hear information about self-harm. If you're feeling vulnerable at the moment, you may not want to listen to the following information. The National Institute of Clinical Excellence defines self-harm as self-poisoning or injury irrespective of the apparent purpose of the act. There are many reasons why young people engage in self-harm, and individual episodes of self-harm may have different triggers and contributing reasons. The most important thing to know about self-harm is that it's purposeful and meaningful. It serves a need or a function. It can involve the act of doing something to cause harm or omitting to do something which in turn causes harm, such as not taking prescribed medication. There are many forms of self-harm. We're now going to listen to an audio clip that explains a little bit more about self-harm.
What is self-harm? Self-harm is when somebody intentionally damages or injures their body. There are many ways in which a child or young person may self-harm. This includes cutting, burning, head-butting or head-banging, skin-picking or scratching, not taking prescribed medication or over-medicating, misusing drugs or alcohol, engaging in risky sex, not eating or drinking, or ingesting harmful substances, getting into fights, over-exercising, taking risks, neglecting oneself, hair pulling, or tying ligatures. This is not an exhaustive list. Who engages in self-harm? Anyone can engage in self-harm behaviour, including young children and adolescents. It is hard to know for certain how many young people self-harm, but the statistics suggest that approximately 1 in 10 young people will self-harm at some point. There are some groups of people who are more at risk of self-harming than others, including girls and young women, although more boys are self-harming than ever before, young people aged between 15 and 25 years old, those who live in residential care or secure institutions, those who identify as LGBTQ, those with learning disabilities, those involved with the criminal justice system. Drinking a lot of alcohol can significantly increase the risk of self-harm in young people who are already feeling stressed or depressed. Why do people self-harm? There are many reasons why someone engages in self-harm, and each individual episode of self-harm may have a different trigger or reason. The most important thing to know about self-harm is that it is purposeful and meaningful. It serves a need or function. Some young people may be able to identify the triggers or function that the self-harm serves, whilst others may not be able to identify, express, or communicate this, particularly when they are distressed. Common functions of self-harm include attempting to reduce the intensity or frequency of overwhelming thoughts and feelings, experience a different sensation or experience from the one they are currently feeling, particularly if they are feeling empty or numb. Self-harm can be a form of distraction from other difficult experiences and situations. Self-harm may be a way of expressing and communicating how they are feeling, as well as eliciting care and help from other people. Some people use self-harm as a way of punishing themselves or wanting to gain a sense of control when perhaps they feel overwhelmed and out of control in other areas of life. Not all those who engage in self-harm want to or will end their life by suicide. Self-harm may have multiple functions, so it can be difficult to understand why exactly someone may engage in this behaviour. Furthermore, some young people know that certain behaviour is harmful and purposeful and can be called self-harm. Other young people may not be as aware that the behaviour they engage in is a form of self-harm. They may see their behaviour as out of their control or be unaware that it serves a function or purpose. Self-harm often has a short-term effect in meeting a need. This is why people often repeatedly engage in self-harm behaviour. The effects only last so long before the person feels compelled to do it again. What are the signs that a young person might be engaging in self-harm? Self-harm can be a very secretive behaviour, as it's often associated with feelings such as guilt and shame, which can make it hard for someone to share how they are feeling and what they are doing. Here are some signs to look out for. Unexplained cuts, bruises, or cigarette burns on the body. These marks could be anywhere on someone's body. Unexplained blood stains on tissues, sheets, or clothing. Keeping themselves fully covered at all times, even in hot weather. Self-loathing and low self-esteem. Blaming themselves, thinking they're not good enough, or expressing a wish to punish themselves, making statements of worthlessness or hopelessness. Becoming very withdrawn and not speaking to others. Unusual weight loss or weight gain, or changes in eating habits. A young person may try to hide this by wearing loose clothing or being secretive about eating. Evidence of vomiting in toilets, wash basins, showers or baths. For example, drains may become blocked. How you can support a young person who is engaging in self-harm or who you think might be engaging in self-harm is covered later in this workshop.
Following on from the information we've heard about self-harm, we're now going to think a little bit more about suicide. Suicide is the act of intentionally and purposefully ending one's life. In 2018, there were 730 recorded deaths of young people by suicide under the age of 25. For every suicide, there are many, many more young people who attempt suicide every year. A prior suicide attempt is the single most important risk factor for future suicide in the general population. A person who has attempted suicide is 100 times more likely to end their life by suicide than the general population. So we've now considered mental and emotional crisis, self-harm and suicide. So let's watch a video that seeks to look at common myths about self-harm and suicide.
Why does a young person end their life? Suicide is a unique and complex experience. Each suicide is caused by individual, dynamic, and complex interplay of genetic, biological, psychological, and social factors. Known risk factors include certain personality traits and individual factors such as having a mental health illness, including depression, mood disorders, eating disorders, and trauma. Drug and alcohol misuse, perfectionism, impulsivity, difficulties with regulating emotions and problem solving, rigid or black and white thinking, low self-esteem, previous suicide attempts. Identifying or belonging to a group with protected characteristics, for example, age, disability, race, sex, religion, sexuality and gender identity, pregnancy and maternity. Environmental and social factors such as academic struggles, not having social and family support, feeling isolated and alone, being bullied or a history of being physically or sexually abused, family history of suicide, media coverage of suicide which includes details of the method of suicide, and local incidences of suicide. Whilst there are known risk factors, there are also known protective factors. A protective factor is something which promotes resilience and prevents or protects against a young person acting on thoughts, urges, and plans to end their life. These include a sense of purpose, of meaning in life, having activities to engage in and be involved with, developing problem-solving and emotional coping skills, social support and feeling connected, feeling as though you belong and are cared about and have people to care about. Limited or restricted access to lethal means of suicide. Cultural and religious beliefs that discourage suicide. Clinical intervention and treatment for mental health disorders. Signs that a young person may be experiencing thoughts or urges to end their life. It can be difficult to notice if a young person is experiencing thoughts and urges or even making plans to end their life, particularly as suicidal thoughts and urges can occur suddenly, unexpectedly, and impulsively, especially among adolescents. Some signs include, but are not limited to, withdrawing from friends, family, responsibilities, commitments, and previously enjoyed activities. Low mood and/or irritability which is uncharacteristic. Uncharacteristically reckless behaviour. Disinterest in maintaining personal hygiene or appearance. Poor diet changes, rapid weight changes. Appearing distracted or agitated. Poor sleep. Alcohol or drug misuse. Expressing or appearing hopeless. Failing to see a future or appearing to give up or be disinterested in their hopes, dreams, goals or ambitions. Believing they are a burden to others. Saying they feel worthless or alone. Talking about death or wanting to die.
So I'm here with Lucas and we're going to myth bust. We're going to talk about some common myths that we hear around self-harm and suicide and give you our responses as to what we think is really going on here. So Lucas, you're going to share with us the first myth.
Hi Emily, first up is people who self-harm are just attention seeking.
So attention seeking is a phrase that's become associated with negative connotations, like the individuals being manipulative or dishonest about the intention or purpose of their behaviour. And that narrative is really stigmatising. It's hurtful and it can stop young people from disclosing how they really feel and the behaviour that they're engaging in. Self-harm can be a method for individuals to express and communicate and cope with complex and overwhelming emotions and thoughts, which they may struggle to do verbally. And self-harm is a way of eliciting care from other people, and if somebody is engaging in self-harm behaviour in order for others to notice, pay attention or to get care, then that should be accepted and responded to without judgment or blame and with, care and compassion.
Myth number 2, self-harm is contagious, they are just doing it because their friends do it.
So it's unlikely that the sole reason somebody engages in self-harm is that their friend is engaging in self-harm. A young person that is having all their needs met in a healthy, adaptive way wouldn't engage in self-harm purely due to kind of real or perceived peer pressure, social status, or for social inclusion. Having said that, adolescents have important developmental needs, such as wanting to belong, feeling connected, and being part of a group or community. And meeting those needs are important for their growth, development, and to thrive during adolescence. And that does make adolescents more susceptible to social influence. And sharing problems and experiences can sort of forge that sense of being understood and connectedness. And that in turn can have an exacerbation effect on sort of poor mental health or emotional coping and sort of associated behaviour such as self-harm. So it's really important to remember that self-harm is functional and it serves a purpose. And in those that appear to engage in self-harm where perhaps social factors are significant, it's identifying what the individual and collective needs are of those people who are engaging in self-harm, so that perhaps more adaptive and less harmful ways of meeting those needs can be explored.
Myth number 3. People shouldn't show their self-harm injuries and scars.
So it's really important that no one feels judged or blamed for engaging in self-harm behaviour. The first priority is absolutely ensuring that the young person has their self-harm injuries appropriately treated and dressed if needed, to prevent infection or further harm from occurring. And many young people, they won't they won't want to actively display their self-harm injuries or scars, but neither should they be made to feel as though they've done anything wrong or that they should be ashamed of having injuries and scars. So to manage this, young people together with their parents and carers or other adult care providers, so maybe school staff, can perhaps discuss how best to manage this in a way that the young person doesn't feel stigmatised or compromised, but it also takes into account perhaps other young people's needs, such as within the school environment. It is important to remember and understand that, visible signs of self-harm can be distressing or triggering for other young people. Of course, there may be times when self-harm is visible, so perhaps it's a hot day and the young person chooses to wear a short-sleeved top. And in those instances, perhaps the young person, together with their parent or carer or support from another adult, wants to think about what they might say if they're approached by others about their self-injury scars.
Myth number 4. People who self-harm are suicidal.
So it's not necessarily true that people who self-harm are suicidal. People can engage in self-harm without any thoughts or urges, plans or intent to end their life. Some people who engage in self-harm may experience thoughts and urges to end their life, but the self-harm behaviour is not an attempt to end their life. And some young people may engage in self-harm behaviour which could be life-threatening, even if they're not intending to end their life. Research does suggest, though, that about half of those who end their life by suicide have previously engaged in self-harm behaviour. Many of the contributing and risk factors for somebody engaging in self-harm or ending their life by suicide are similar, so it's really important to explore with somebody their intent and their function of the self-harm to establish whether or not they're also experiencing thoughts or urges to end their life.
Myth number 5. The severity of the self-harm reflects the severity or intensity of a person's difficulty or distress.
So the nature and the degree of self-harm is not reflective of an individual's difficulties or distress. What is important, though, is to try to understand the function and the purpose of the self-harm in order to sort of best support and help an individual. It's really important to take the person seriously, regardless of how severe their injuries are or appear to be. You should never assume that a person's difficulties or distress are not serious or not having a significant impact because their injuries are not.
Myth number 6. Asking someone if they are thinking of suicide or using the word suicide puts the idea in their head and makes them more likely to do it.
This is not true. Asking somebody if they're thinking of suicide or using the word suicide does not put the idea in their head or encourage them or make them more likely to do it. People can find it really hard to initiate talking about how they feel and find being asked direct questions much easier to respond to. Being clear and asking directly about suicidal thoughts, urges, plans or intent can kind of allow you to really understand or to discuss what's happening and make a plan of action together. Asking somebody directly about suicide and using the word suicide ensures clarity and no room for misinterpretation or error. It also avoids judgment, as statements such as doing something silly can really invalidate how somebody is feeling and add to their sense of worthlessness and being a burden or not being taken seriously.
Myth number 7. People talking about feeling suicidal are not intending to take their own life.
Okay, so this isn't necessarily true. Experiencing suicidal thoughts and urges is a unique experience. Some will feel unable to share or talk about how they're feeling, whereas other people might feel more able to do this. But regardless of whether somebody is able to verbally or directly express and communicate those thoughts and feelings of suicide, or they try to communicate non-verbally or indirectly that they're struggling in this way, everybody deserves respect, care, support, and to be taken seriously.
Thanks, Emily.
Thanks, Lucas, for going through those myths with me. Let's hope that people have found that a useful learning experience. So for more information around crisis, self-harm and suicide, please do visit the Hampshire CAMHS website, which is www.hampshirecams.nhs.uk. Let's consider now confidentiality and information sharing. If you are aware that a child or young person is at risk, including harm to themselves, harm to others, or harm from others, this information must be clearly documented and shared in order to protect and keep a young person safe. You must do this in a timely way. You should share information with the parent or carer, your supervisor or line manager, the safeguarding lead, and any other agency or person involved in supporting with or working with the young person if it's appropriate to do so. Here are some tips on how to share information. First of all, check and follow your organisational policy. Make sure that the young person knows that you're going to share information, including what information you're going to share, with whom you are sharing it, and why you need to share it. Only share what is relevant, appropriate and necessary. Be clear what is fact and what is opinion. And try to include young people where possible in meetings about them, and think about how to make these as young person centred as possible. And ultimately, have a think about how would you feel if you were in a young person's shoes. Be respectful and be sensitive. Here are some steps that you can take if a young person is in crisis or makes a disclosure of self-harm or suicide intent. First of all, protect some time and space to listen to them without interruption. Think about the setting that you're in. Try to listen calmly without judgment or rushing to solutions, unless it's an emergency and requires immediate intervention, in which case you must absolutely act accordingly. Validate the emotion that's being experienced, not necessarily the behaviour. Try to provide the young person with information about where or how to access appropriate support. Encourage young people to make safe, informed decisions. And please don't make promises that you can't keep. Now we're going to watch another short video from young people about what helped them when they were in times of crisis.
Now that I've started opening up to people, the biggest things are so much smaller. I've started listening to some music when I'm feeling down, and it's just so helpful.
When I was experiencing a crisis, I found it helpful to make some tea or have a bath or just to cuddle with my mum. And after a few hours, my feelings would feel a lot less intense.
Having someone listen to you with an open mind and respond empathetically is really helpful. Someone just caring about you and being there, validating you and telling you that it is okay.
I find that having people I trust, like my family, friends and loved ones around, is so important. People that you can lean on. So I spend a lot of time outside, gardening or playing with my dog. I also do yoga before I go to sleep so that I can try and help aid my sleep, because sleep is so important for your mental well-being.
Just speaking to people, whether it be family, friends, or even if you don't feel like speaking to anyone, just writing down your thoughts and feelings, just to lift that weight off your shoulders.
I needed to open up that very real and raw and honest conversation about what I was struggling with, about what I needed. And not only is that probably one of the hardest things to do in crisis, but it is the most important thing to do as well.
If a young person has engaged in a potentially life-threatening behaviour or is at risk of harm, they must seek medical help immediately. In all other situations, the following should be considered. Hospitals can be busy and noisy. They can be very distressing environments which can increase anxiety and agitation. A young person should only attend accident and emergency, A&E, if absolutely necessary. There may be alternatives such as seeing their GP, attending a walk-in centre, or calling 111 to speak with a trained mental health professional 24 hours a day, 7 days a week. Consider how else the situation could be safely managed. the young person may be able to communicate what would help them best in that situation. Check and see if the young person has a crisis or coping plan that can be followed. And ensure that the parent or carer is made aware and that a plan is made together to help keep that young person safe. If a young person does need to go to hospital, please ensure that an adult who knows the young person attends the hospital with them, ideally somebody that the young person has identified themselves. Ensure that you have all the relevant information about the young person to hand so that this can easily be passed to medical professionals. Ensure appropriate adults have been informed, such as parents, carers, social workers, or other professionals that may be involved with supporting with or working with that young person. Try to help prepare the young person. Inform them that information may need to be shared with others. Think about self-soothe resources and techniques to help reduce anxiety, so headphones, phones, tablets, books, magazines, notepads, pens, fidget toys. Ask the young person themselves what might help or what they might want with them. Have water or snacks. Sometimes there's a long wait to be seen at hospitals. And think about what follow-up care and support the young person might need. You can also consider making a crisis and coping plan with a young person. Every young person could benefit from having their own personal crisis and coping plan, whether they are known to experience crisis or not. A crisis and coping plan can be completed by anybody, but should always be done with a young person. A crisis and coping plan usually considers the following elements: what it looks like when a young person is well and coping and functioning at their usual level, what the early warning signs are that a young person may be struggling, what signs indicate when a young person's in crisis, what are some of the triggers or contributing factors to crisis, and an action plan of what to do when the early warning signs start to show, as well as an action plan for what to do when that young person is in crisis. For a copy of the Coping and Crisis Plan, please click on the link below. And finally, this slide has many links to resources that can help young people, parents and carers, and professionals working with young people who may experience crisis, self-harm, or suicide intent. You have now completed your e-learning package. Thank you, and I hope that this has been helpful to you and your work with your young people.